House Republicans have finally released their billion-dollar cost savings plan to pay for President Donald Trump's tax cuts. And lo and behold, after saying that Medicaid was safe, the plan calls for billions of dollars in Medicaid cuts. Now, the politics of this in Colorado are interesting because the two congressional districts that have the largest share of Coloradans on Medicaid are represented by the two most vulnerable Republicans in Colorado's congressional delegation. According to preliminary plans released this weekend, a lot of those cuts are going to come from Medicaid in terms of the $880 billion that is coming from one committee in particular. This could mean new work requirements, education service requirements for adults without dependence or disability, some new out-of-pocket costs for Medicaid recipients who live above the federal poverty line. House Republicans are also suggesting reducing federal reimbursements to states that allow people living in the U.S. without authorization to sign up for Medicaid. Colorado is one of those states that allows children and pregnant women to sign up for Medicaid coverage no matter their immigration status. That particular program has been a target of Republican Congressman Gabe Evans. Evans sits on the House Energy and Commerce Committee, so he's going to have a direct impact on deciding any cuts to Medicaid.
And unfortunately, we've seen where Colorado's priorities lies. They are spending tens of millions of dollars funding health care for illegal immigrants instead of cutting fraud, waste, and abuse. I am committed to making sure that we are good stewards of taxpayer money.
Evans's district has one of the highest proportions of Medicaid recipients in the state. Nearly 25% of his district relies on Medicaid. That's second only to Congressman Jeff Hurd's district on the Western Slope, where 30% of Coloradans are on Medicaid. Hurd has been on the other side of this. He's urged Republican leadership to preserve Medicaid, though Hurd did tell us earlier this year that work requirements would not be out of the question for him.
I think a work requirement is something that makes sense. Obviously, we would want to account for individual circumstances for those that are studying in school, but a work requirement is something that makes sense.
It's not just Medicaid. Republicans are also considering changes to the Affordable Care Act and the repeal of Biden-era green energy funding to pay for tax cuts.